name is Lydie Ichoupe. I'm from Cameroon, and I'm here in India. I came here in India for my treatment because I was diagnosed for one endometrium cancer. Yes, this thing occurred in 2028, June 2028. Yes. I was in my period normally, but one in the morning when I reach my office, I feel as more bleeding is coming out, and then I get worried. I run to the pharmacy to ask what is wrong, and then pharmacist told me that it can be an hormonal problem and it would settle. But after 1 week, 2 weeks, nothing going well. Then I went to see my doctor, and after investigation, they told me that I have a polyps inside my uterus, and then I will have to do hysteroscopy. That I will do and do hysteroscopy. That was done, and also after that I have surgery hysteroscopy. But after my surgery, I felt a little change, but nothing was not well at all. So I started running hospital after hospital, doctors after doctors, and they started talking about fibroids, myomes, and then they told me that there's no treatment for my case. I have one, but I wanted to have another one. So when I heard this, it was too difficult for me. I didn't believe, and then I want to have another opinion. The second opinion came with the same diagnostic. In my country, there's no way to take good care to cancer patients. So I think to go where my problem will be taken very well, where I can see specialists who can take very care to me. And India was my destination. When I came here, I cannot lie, I was thinking about different diagnostic. I was thinking about miracles. I was hoping that my situation would be different. I can give birth. But when I reached India, I met my doctor, Dr. Richa, here beside me. And another biopsy has been done, and my diagnostic was the same. So she advised me to take my uterus out. That was the best solution for me. Taking my uterus out and preserve my ovaries. My surgery has been done properly. I was thinking that everything is behind me, but after investigation post-surgery, it was a little, I don't know how to call it, something like imbalances.
That's okay.
Yes, and I had to do radiation, internal and external radiation. Now I'm feeling as free. Dr. Dipali was my doctor in radiation. Yes. Now everything's okay. I finished with my radiation, internal and external, and I hope that everything is now well for me. Indian people are just so wonderful. I felt like in family, everybody was just so kind with me. Like I can say that India is my second country, because everybody is so kind here. Welcoming people, warm people, protective people, and especially hospital. This hospital is in my whole life, I have never been in one hospital like Apollo Hospital. It's just how can I say it? Just so wow. Specialists are just so You cannot say this one in my country now. Sitting with my doctor, speaking so relaxedly, you cannot say that in my country, no. But I feel in my house. India is my second country now. My doctor is so how can I say so available. I'm well now. I hope that everything is okay. Cancer is so difficult, but I have been with specialists who convinced me that everything could be okay with me after this, just to accept that. And today I have the chance that I have my little boy, and I can live properly as everybody. So I'm so happy. I can here thanks my doctor. I can say thank you to you. Thank you to Dr. Dipali. Thank you to Dr. Power. Thank you to all nurses and therapists. Thank you to everybody. I felt really as home, and today I'm going back, and I will be back very soon. Thank you.
Hello everyone, I am Dr. Richa Bansal. I am a consultant Gynaec-Oncology surgeon, that is female cancer specialist surgeon at Apollo Cancer Center, Navi Mumbai. So, continuing from where she talked, I'd like to give a few insights about cancer of the uterus in young women. Now, uterine cancer or cancer of the womb most commonly occurs in older women or post-menopausal women, generally in their 50s and 60s. But occasionally we do see uterine cancer in younger women, and in fact the incidence of uterine cancer, especially in younger women, has been rising, and we have been seeing uterine cancer in women as young as in their 20s and 30s. Now, what are the common reasons for this rising incidence of uterine cancer, especially in young women? The most important reason is obesity and sedentary lifestyle. Once uterine cancer risk rises in direct proportion to their weight, another common problem is polycystic ovarian disease, which is a common condition affecting young women and young girls, being associated with hormonal imbalances and causing irregular periods. Other common reasons are infertility, then having less number of children, delaying the first pregnancy and childbirth beyond 35 years of age, and so on. And few of these cancers in young women could also be familial or hereditary. Now, the most common symptom of uterine cancer in these young women is irregular or heavy menstrual periods. So, whenever a woman, especially with these risk factors like obesity, infertility, history of polycystic ovarian disease, or history of irregular periods, heavy periods, diabetes present with such abnormal symptoms, one should never miss on doing an endometrial biopsy before prescribing them hormonal tablets or symptomatic tablets. So, treatment of uterine cancer for these young women should be very carefully planned, and definitely egg or embryo cryopreservation is an option for these young women for future IVF and surrogacy after detailed counseling. So if you all have any doubts or concerns regarding this uterine cancer in young women, you all can reach out to us at Apollo Cancer Center, Navi Mumbai. Thank you.